honor to have this invitation in Africa Health Expo. In continuity with the presentation, the great presentation of Dr. Muhammad Hany, I would like to continue with a brief review on AF in the era of AI. AF is still the most common sustained cardiac arrhythmia, with 5-fold increase in the risk of stroke, 3-fold increase in the risk of heart failure. Despite improvement in the management, still there are key challenges in the AF management, notably challenging in the diagnosis, challenging accurate risk stratification of the patients, complex decision-making for individualized management plans, challenging optimizing catheter ablation outcome, and finally, challenges regarding long-term monitoring and AF burden assessment. This leads to high variability in clinical practice, healthcare burden increase. So how can AI, and we are in the era of AI, help in overcoming the AF management challenges? And this figure published last year maybe summarize many aspects of which AI can help. Many of them are already elaborated and we have it these days, and some are for the near future to come. Artificial intelligence is the simulation of the human intelligence. It has many forms, but those who are implicated in medical applications are especially the deep learning, which is a subset of machine learning that uses neuronal networks, complex neural networks, CNN, that works in the same way of our brain, with multiple layers of complexity to understand patterns and especially understand imaging like ECGs and 3D mappings. Also the computer vision for image interpretation, SCT, MRI, and ECGs. And these models can learn through multiple ways, either by supervised learning through labeled data, or by unsupervised learning, finding hidden patterns in unlabeled data. So they can find things that we didn't label by our own brain and find more data that we can't even think of in the normal way. And finally, the reinforcement learning, which is through trial and error to maximize the output. We are all aware of the presence of ECG machines that can read and interpret the ECG with quite of an accuracy. But in 2019, in The Lancet, they have published an AI-driven algorithm that can predict and detect atrial fibrillation, paroxysmal atrial fibrillation in sinus rhythm, in patients with sinus rhythm. Through thousands of patients and thousands of ECGs, the AI algorithm have learned to identify patients with paroxysmal AF in sinus rhythm ECG with an accuracy of almost 80%, based on P-wave characteristics of the RR interval and F-wave frequency spectrum. We are all aware of the wearable devices, the smartwatches detect AF, but when we see the numbers of the studies, they are impressive. With an accuracy of a positive predictive value of around 85 to up more than 90% of positive predictive value and accuracy. What's important and more interesting is that 80% of high-risk patients who have used these devices in health studies of Apple and Huawei have received oral anticoagulation. They have been prevented, started the prevention for thromboembolic complications related to AF. And in the follow-up of the Huawei heart study, we can see that it has shown a significant reduction in rehospitalization and clinical adverse events compared with normal care group, and that has been published in the JACC a few years ago. regarding the classification of AF, we probably will see in the coming years more classification not related to the duration or the time of AF, like we have today for the permanent or conditional AF, through complex cluster analysis of unlabeled data. We will have our patient classified, predicted for their risk for thromboembolic complication, for bleeding complication, and for the efficacy of treatment. This is a way that we didn't have before, since the AI have shown a superiority in risk stratification of AF. Like this study published a few years ago that showed that compared to the classical Shetland score we use, which has an AUC less than 0.5, combined with an AI algorithm, the area under the curve has decreased and reached more than 0.7 as a whole. Followed by this study, many studies have followed and shown the superiority of the AI in risk classification of patients with AI, with the AF, in terms of the prediction of stroke, major bleeding, and even all-cause mortality. So diagnosis, classification, and now for the treatment and the individualized treatment, what we call the precision medicine in AF. Driven by AI, we can optimize anticoagulation dosage, better monitoring of antiarrhythmic therapy, and provide and enable real-time monitoring of AF patients. Like this study published in 2019, showing that AI-driven algorithm shows superiority in the measurement of QT interval and other parameters of the QRS and the ECG to detect and identify patients at high risk over their treatment on antiarrhythmic medication. Also, in the identification of patients for electrical cardioversion, those who benefit from electrical cardioversion and have a high success rate are better identified using AI-driven algorithms. And finally, for the catheter ablation of AF, AI-powered electroanatomic mapping is now a reality, and we have it in our labs through real-time procedure guidance to increase procedure precision and outcome. The procedure is highly operator dependent, the AF ablation procedure, and the recurrence rate of AF is still high, especially in inexperienced hands. And the solution is in an AI-driven algorithm, and that published and developed by the Bordeaux Group in France in collaboration with the Volta Medical Company. They have published a very interesting study through an AI software, the VX1, that will give real-time guidance for the procedure. And in 8 centers in Europe, with 17 operators with different experience level, they've shown that using this software guiding in real time the procedure, there was no significant difference between the different centers and between the different operators, despite the different experience and years of experience of these operators. The tailored AF published last year have shown that an AI-driven real-time guidance through the Volta AF Explorer have shown a success rate superior to conventional procedure with 88% success rate versus 70% for a single procedure. And finally, the Genus stereotaxis system, which enables physicians to navigate the ablation catheter remotely. We can imagine that with that progression and development of AI, we can see this system auto-navigated with AI, without intervention from physician or by supervision simply of physician. This is the future probably, and for my take-home message, nowadays we have many procedures and many interventions that have been integrated with the eye. In the near future, we will have even bigger and bigger innovations. It has an excellent image identification that helps AF detection. It has an excellent processing big data which enable us for better decisions and for perform comprehensive treatment from choice, dosage of anticoagulation up to guiding in real time the AF caster ablation. Future studies will demonstrate its full potential in individualized management and improving the prognosis of patients with AF. And thank you very much.